Okay, good afternoon. This is Kaftan TV. Yes, that station, that institution that is a friend of the public, especially when it comes to dissemination of information and education and enlightenment. Now, this is one of the programs. Here, we discuss topical issues. We bring issues of national importance to the platform of discussion, where we reach a consensus, especially with you, our viewers out there, who will have the opportunity to call in and be part of the program. Today, we are talking a very serious issue. In fact, before we started this program, and I mentioned the topic of discussion to a friend and colleague around here. He said, that's what you are discussing. That thing has finished in Nigeria. We are just not seeing it. What are we talking about? What is this humongous problem that everybody feel is a ticking time bomb? Today, we shall be discussing the drug issues. Yes, illicit, banned substances that many Nigerians, old and young, male, female, yes, female, are indulging in, that has ruined lives, destroyed families, livelihoods, and even individuals. Yes, drug is killing more Nigerians than we all can fathom. Today we shall be taking a look at the trade and consumption of illicit drugs, whether it is a ticking time bomb or not. Those are the issues that we'll be discussing on this program this afternoon. I am Shegun Ojelade, and I have with me in the studio two eminent gentlemen. And then there are others that will join us, on phone. But we have others that will still join us in the studio. And we have somebody that will join us via Zoom from Asaba. Now, for those in the studio, I have with me a frontline crusader against drug abuse. He is in fact a former Deputy Commandant General of the National Drug Law Enforcement Agency, NDLEA. He retired some few months ago. I'm talking of DCG Mahmood Sule. It's a big fish where you talk about the drug problem in Nigeria. I welcome you to the program.
Thank you very much.
Yes. Now, on my far right, as a young man, he is Mr. Uchui Augustine. Mr. Augustine is a consultant mental health, drug, alcohol, and illicit substances use. Is a very known face, somebody that is working quite seriously too, with some huge experience on the drug problem in Nigeria. I welcome you to the program, Mr. Augustine.
Thank you for having me.
Now, let's start from because when we talk about the drug problem in Nigeria, we say it's huge, we say it is devastating, we are not getting, apart from the releases from NDLEA about those that have been caught and the amount of drug that have been seized from them. Apart from those ones, how serious is the drug problem? We are all going about our normal duties, and you go to homes, everything is fine, offices on the road, How serious, apart from those seizures, there are other manifestations of the drug problem in Nigeria that cannot be seen with the naked eyes?
It's seen with the naked eyes. It's there for you to see. If you say you don't see it, then you don't want to believe that there's a problem. When I came in here, I was telling you that the problem is magnitude. But we don't want to accept that the problem is there. I went to the mechanic workshop to fix my car. As I was there, some young men brought in their car and they were smoking cannabis sativa as if they were smoking cigarettes. When we were growing up, if you want to smoke cannabis sativa, Igbo, you go to the bush.
Going to the bush, yes.
But right there, they were smoking it.
A full glare of
that's what I tell you, there's a problem. Go to the campuses, the streets, the problem is there. And if you don't want to accept that the problem is there, like I told you, we're in a state of denial. You go to school, you say, do drug tests for your students, especially secondary school. Oh, the parents will not accept. The parents will withdraw their children. The problem is there. They know it, but they say it. They don't want to accept it. That's the challenge.
Do you agree with him?
Absolutely. Because you see, over time we have lived in denial, just like he rightly pointed out. Most of the times young people have begun to indulge themselves in this illicit drug, we call it substance abuse, just to sugarcoat the word. I call it what it is. Drug is drug. No sugarcoating of anything, no trying to put it in a better way. If you are a drug user, you are a drug user. And we put it back in the society. Some of these parents already know that their children are taking these drugs. They are drug users. But they look for a way, because you are a big name, you don't want your name to be, in the news out there that, oh, your child is, they try to cover it up. And this covering up, instead of seeking help, is what is causing all these things. Because I was walking through a street today around Use axis, and when I got to a particular spot close to the stream, all I was perceiving was weed everywhere, as if they were burning bush. Today, I'm not exaggerating, this is what is happening. If you go to town, all these bridges, under the bridges you see people, all these we call them agbero, they smoke it in public now. It's not like it used to be, where he pointed out that it used to be hidden and all those things. A friend of mine dropped me off in one of these popular bridges in town on Friday evening after close of work, and I discovered there in my front someone was smoking. What was this person smoking? It was raining. All of us were just standing to see how we can shield ourselves from the harsh weather. And someone was there smoking. What was he smoking? Weed. In public. In the midst of every other person. With no shame, with no respect for the other person who is not taking this drug. The problem is, it has always been there. It is now left for us as a people to accept this issue and see how we can channel our energy, teach ourselves, tell ourselves that this is not helping us, and until we do that, we are not heading anywhere.
It is not helping us will be my next question to you, so please bear that in mind. Now let me ask you this, because of your experience with the NDLEA, we can still call you a pioneer member of that agency. How did we get to this level? How did the whole thing started, to the extent that we were thinking that it was in the university in those days? It moved from university to the secondary school. Now even we don't know whether our children in the primary school are engaged in it. Even our mothers, they are on drugs. How did we get there?
For me, I always look at the societal values. If you take your mind back, when you were in the secondary school in those days, you are fully engaged. First, if you're in a boarding house, you do what they call afternoon and night prayer, compulsory reading. If you're a day student, there's the afternoon prayer. It's compulsory. After the prep, you do games, you do labor. Then every school will have its inter-house athletic competition. Every school. Then we also have what you call agricultural science being a compulsory subject. Whether you do science or not, you take agricultural science. Why? The ridge, you go and farm. Either you have a cassava or a yam ridge, you farm. The teachers were lords. During the holidays, we have what you call summer classes.
Classes, yes.
Long vacation classes. These have disappeared. You don't have them again. Again, when we were growing up, the fear of the tenant in your father's house was the beginning
of wisdom.
Because whatever that tenant tells your father that you have done wrong, your father will not doubt it. And those tenants also have the power to spank you if you misbehave.
Yes.
These have all gone. So, what do you expect? So, what happened is that over a period of time, the societal values have been eroded.
Degenerated.
So, that is where this indiscipline
started
creeping in. And that is what has led us to where we are today. You are going out, your father must know where you are going to. Your mother must know where you are going to.
And approve of it.
Yes. You buy a car, your father must know the source of your income. It's no longer like that. You are in the university, you are driving 2 cars. You are in the university, you live in the hotel. You are in the university, you wear the most expensive dresses. The societal value has eroded. That is what led us to where we are now. Nobody asks you again, how did you get what you have today?
Okay.
And again, look at school. In those days, we used to have Division 1, Division 2, Division 3. When you ask somebody, what is your WAEC result? You say, I make 2 papers. I make 3 papers. So the substance, the bottom line is the society has created what we have now.
Okay.
Monster.
You put it under a very general umbrella of society. They say family is the nucleus of society.
Yes.
So why don't we just put the things squarely on society? I mean on the family, mothers and father. When we have a derelict father or even a derelict mom, or too busy, the two of them are too busy running after whatever they are running after, to the neglect of the children. I think that is a major problem. We don't have time for them anymore.
No. You see, why I'm talking of society is, let them not just put it on the family. The family has a role to play. The school has a role to play. The religious body has a role to play. Voluntary organizations have a role to play. Look, I was a Boy Scout. What does the Scout does for you? What is the motto? Be prepared.
Be prepared.
So what I am today, I learned it from the Boy Scout. Do you have real Boy Scouts organizations now?
No.
See the Boy Scout you have now. Where are the Girls Guide? Where are the Red Cross? Where is the Boys Brigade? The man of war you have now was not the man of war we had then. So when I say society, it's general. It's not just the family. The family is just a minute aspect of it. You can grow up in a disciplined home. You
and then be corrupted by in the school.
That's why I say societal. Yes, the parents are busy. Yes, they must find something to take care of the home. But on the aggregate, there's something. Okay, let me give you an instance. The chairman of NDLEA, Brigadier General Abuba Marwa, since he came in, he has been advocating for drug tests for schools. He has been advocating. He has even advocated that before you get married, you should do it. He has been talking to the religious body.
Has he also been talking that even politicians should be tested?
Yes, he said it. He has advocated everybody, every segment of the society. We're just waking up from the slumber now. The universities are keying in.
Gradually.
The Minister of Education has just said, on the prompting of General Abuba Marwa,
yes,
that
admission, yes, should be conducted in a university.
Let me tell you, so many years ago, when I tell you society, is that the federal government, in its wisdom, incorporated the teaching of drug education into the relevant school subjects of primary and secondary schools. It was never taught. Why? It was never. Yes. Probably.
Don't blame education administrators. He who made the law. Why not ensure its enforcement? They have both the power of enactment and enforcement. Why did they go further?
I'm not blaming anybody. I'm only telling you, years ago, there was infusion of drug education into primary and secondary school, relevant school subjects. Yes.
Okay. Now, I promised you that I will get back to what you were saying earlier about it's not helping us. That the pervasive use and sale of drug is not helping us. What are the manifestations that you can see that these things that are happening is as a result of our indulgence or pervasive indulgence in drugs in this country? What are the areas of manifestations that you can see?
Okay, when you see in our society today, when you see a young man or a young woman who have not been able to articulate or who is beginning to act incoherently, who is not able to actualize what their aim were supposed to be, suddenly you just see someone from nowhere, someone who you know who was given a good upbringing from a better family, and then from nowhere this person will just change to become who he or she is not. He's no longer attending classes. Let's start from the student side. He's no longer being articulate. He's becoming reluctant to do some certain tasks he or she ought to do. He's becoming a truant
and a recluse.
Exactly. Then you see them being secluded. They can lock themselves inside so long as they have what they need. Sometimes, as young people, we hear them, they say, loud. We have loud, they call it all kinds of names. Sometimes when you go, they say, I need ice, I need this. It's just to cover up so that you don't know. Sometimes they will even call a name of a drug very before, and you will not know it's a drug they are talking about. And these are really affecting us. You can see a young person who was doing well before, all of a sudden in their job, they will just go down. It's affecting the society, and it's also affecting the mental health of these people. Because mental health is just a complete state of your psychological and emotional well-being. And if you are not psychologically okay, or you are not emotionally stable, then it becomes a problem to the society. Then we have a lot of times when we talk about the mental health and mental disorder, people tend to feel, when you just mention mental health, people tend to be like, oh, you are saying I'm mad. You're not mad. You are just saying that you are not psychologically stable to deal with the stresses of life. Mental disorder is when you start having clinical conditions that require clinical attention. Things like bipolar, schizophrenia, and the host of other things. And depression. Depression can come. Certain. That's why we see a lot of depressed youth out there. some as a result of substance intake, drugs, alcohol. You go to parties, you see all kinds of things. In those days, when we go to party, we were always very conscious of what our parents would tell us, what our parents do. Like, I remember while I was in the university as an undergraduate, there are places I would want to go to. I would remember what my father used to say. It would just ring like a bell. Remember the kind of family you are from. And then I would just be like, this party is not for me. I'll need to go. And there are people that sometimes when you see them with coke, don't even go close to say, oh, I'm thirsty, let me share from your coke. Because they've added a lot of other things.
Okay.
So
there was I remember, it was even this weekend. I went to a small kiosk near my house, and I was waiting on the line to buy what I came to buy. I think it was milk. And there was a guy in front of me, two behind me. I was there, and the Malam shop attendant decided to attend to them. Do you know, I didn't know what he gave them. He just turned to a corner in his he didn't stand up, just turned, picked that thing, I think it was in nylon, and gave them, and they turned back. I now look back to look at the guys. They look very dirty. I knew that what transpired there must be an illegal and shady deal that has to do with drugs. Now, Mr. Mahmood, NDLEA started about 35-36 years ago, and this drug problem hadn't been this bad. So will you say NDLEA has achieved anything?
Yes.
Rather than for us having a reduction, this is what we have today, and we have an agency that is in charge of ensuring enforcement and rehabilitation. Why is the problem so pervasive today?
What's the population of Nigeria? I wanted the strength of NDLEA. If you ask me, I'll score NDLEA 100%, even more. NDLEA has done so well that if NDLEA wasn't there, I don't know what would have happened to Nigeria today. So we should commend NDLEA for what they are doing. They have done so well. Yes. Yeah, they've done so well.
Okay. Will you agree?
Well, he is speaking from...
He is not an innocent bystander.
Yes,
no, he's not. He's an interested party. Thank you. That's why I'm asking you.
But to my greatest... I will appreciate them for their work so far. It's a collaborative effort, and I think since the assumption of the current NDLEA chairman,
yes,
I've been hearing a lot about drug. He has done so well in his part, and what we need to curb this menace, it's a menace.
Yes,
it's awareness, which is what they are doing, awareness and education, and they've been doing so well. Yesterday, I even came across an advert online where I bumped into. I just opened the Facebook post and I saw it. So it's something that they've been doing, and we also, as private individuals, family members and relative pastors, imams and every other person involved, we must key into this awareness and teaching people the right value system. And then back to the family, value system has to come back into play, because he has been mentioning society. Your first point of learning is from the family, as you pointed out earlier.
Yes,
the family. And it might surprise you that a lot of people learned how to take drugs from their parents.
Okay now
can you let me say something?
Okay, quickly.
Let me say something.
Yes.
You know why I say NDLEA has done so well is that the drug problem is a collective effort.
Yes.
This collective effort is not just parents. NDLEA have intervention mechanisms. There's what you call State Drug Control Committee.
Yes.
There's what you call Local Government Drug Control Committee.
Even they have in
There's the
schools.
National Drug Control Master Plan that has defined the road map in addressing the drug problem in Nigeria. NDLEA is a federal government institution.
Yes.
We have the state, we have the local government. Federal government is playing its role very well. Has the state
Done theirs.
have they done theirs?
Thank
The
you.
local government,
Yes.
have they done theirs? I tell you, if you ask the number of states that have state drug control committee, very negligible.
Yes.
Very negligible. The number of local
Sorry,
governments
sir.
where
We have a caller on the line. Yes. Hello. Good afternoon. This is Kaftan TV.
Good afternoon, sir.
Yes. Please, your name and where you're calling from. You are on to a program on Kaftan TV.
My name is Precious.
Precious.
My
Okay.
name is. I'm coming from Boki local government area.
Okay. Boki local government area. Of which state is that? Okay. Please go ahead and make your point.
I saw your news on the television.
Okay.
So you put your number. I just called.
Okay. Thank you very much.
Why is Tinubu suffering us like this?
Okay, we are creating another program for that. When we do that, you will call. Thank you. Okay. Now, if there is anything NDLEA has done, is to raise the awareness and consciousness of Nigerians to the drug issue.
not just that,
Okay.
stopping the flow
Okay.
of drugs.
Okay. I will allow you to continue on that when we come back. Now the program is the Polity. We have been joined by another guest, and is coming. Is joining us on Zoom. So joining us on Zoom is Dr. Moses Tigger. He is a psychiatrist, and he's joining us on Zoom. He's a psychologist. He's joining us on Zoom from Asaba. Welcome to the program, The Polity. We are discussing the drug issue in Nigeria. And like I said before we went on this break, we are being joined by another guest, but this time via Zoom. His name is Dr. Moses Tigger. He's joining us via Zoom, and is coming in from Asaba in Delta State. Doctor, are you there now? Yes. I can see you. Good afternoon. Good afternoon. Yes. Now, I'm sure you've been listening to the conversation before now. Okay. We are still, our engineers are still perfecting the audio, but in the meanwhile, let's continue. Before we went on that break, you were itching to still do some PR for
No.
NDLEA.
No, not PRO.
Okay.
I don't call it PRO because,
Okay.
like I said,
Yes.
if not for NDLEA, I don't know where we would have been now. You saw the tons of cocaine that were seized, the tons of methamphetamine that has been seized, the tons of codeine that have been seized. You saw tramadol, the tons that have been seized. If NDLEA wasn't there and these things find their way to the street, of course, it would have been a third world war.
I even agree with you.
So NDLEA is doing, like I told you, in addressing the drug problem, there's a roadmap. The question is, has NDLEA fulfilled its own aspect of the roadmap? For me, yes. Other parties, yes, I know that drug issues, they are on the exclusive list, but NDLEA has created a pathway for the state government to be a partner, for the local government to be a partner. Have they actually been the partner the NDLEA expect them to be?
Yes. I even want to add that the level of vigilance in catching those that are involved in this illicit drug trade and movement have really been enhanced. The other day I was traveling in a bus with other passengers, and we got to an NDLEA checkpoint, and they asked everybody to come down. Some of us were wondering, complaining, they want to delay us, nobody is carrying, and they now said everybody should come down, carry bags, and then start freezing through it. Lo and behold, there were some parcels of drugs in some of the bags being carried by some of these passengers, and they were the vociferous ones that were shouting, "Don't delay us, don't delay us." Of course, they arrested them, seized their packages, and they allowed the rest of us to go. So even at the airport, the level of seizures now and the desperation with which people carry drugs now, you know, and the eagle eye of NDLEA officials have been able to stop many of them even from coming in and going out of this country.
Let me finish.
Yes.
You know, of cookies, if not for NDLEA, how would you have known that the cookies your children will order is laced with drugs?
Laced with drugs.
Cookies. Just cookies, biscuits.
Cookies,
those small
biscuits,
things.
yes.
People are lacing them with drugs. If not for NDLEA, nobody would have known that such things are happening. So for me, NDLEA has done fantastically well.
Yes, yes.
To commend them.
I agree with
First, what is the manpower of NDLEA? Until General Buba Marwa came, it was 4,000 something.
Wow.
So we are talking of 15,000 now.
Now. Okay.
And we are talking of the country.
The country, the whole nation.
But again, how cooperative are the citizens?
Yes.
I share an experience with you. I was a commander in Bauchi. There was this community that had a drug dealer, and we did all we needed to do. Each time we go there, nothing to come back home. Later, we were able to discover that everybody in that community, they are all related blood. And so they were not ready to give away
they are kith and kin.
There's somebody, a cripple, who was selling cannabis. We will go, we will know the consignment is in his house. We'll raise a team. I was a commander there. We'll raise a team. We go in. You get to the house, the whole house is smelling of cannabis. But you can't find cannabis. My men will climb into the ceiling. They will look everywhere. We got to know later through intelligence that most of the people selling things along the way to the man's house were his own informers. So they were also doing counter surveillance on NDLEA. And behold, when we are coming, what does he do? He had a pit toilet in his house. He pours everything inside his pit toilet. And that's why when you come to the house, it's smelling. So again, I talked of the society, societal challenge.
Yes.
You see, NDLEA is doing well.
But yes. They're not receiving enough cooperation from
the people.
Thank you very much. Now, the program Polity continues. Mr. Dr. Tigger is now online. Doctor, good afternoon.
Yes, good afternoon.
Yes, I know you've been monitoring the program since we started. Please, what are your general comments on the situation as regards trade in and consumption of illicit drugs in Nigeria?
All right, thank you very much, and thank you for having me. So, just like the other guest earlier mentioned, the business of drug use in Nigeria has always been on the rise. The rate at which people, especially young people and women, are using drugs currently is alarming. If it weren't for anything, we can well say it's already a pandemic, because the widespread is really not friendly, and it doesn't look nice. There are many drugs that are currently being used. Cannabis is one of the most commonest that is being used around the country, and in many areas, they are more or less as though they are recreational drugs, even though we are quite aware of the health implications of these drugs, especially because they're already affecting so many of our young people currently. Many of them are on the streets. Some you see them walking around aimlessly, some not even dressed, some naked already. These are some of the consequences that we can even see, because out of 10 persons that you would treat for psychosis, at least 4 of them have used cannabis. That's already something to tell you that there is a significant harm that the drugs are causing. But then it doesn't even stop at cannabis. We equally have other ones that are even produced locally. There are other opioids, other meth drugs that are being produced. We hear names like Mkurumiri. Down here in the south, you hear Mkurumiri is quite a common one as well. And it's taking so many of our young people to a very unimaginable state where we're wondering if the future is still bright with our young people. And in terms of work, I think the NDLEA is doing quite lots of work in terms of trying to curb the spread of drugs.
As a psychologist, are you not bothered by the involvement of women, housewives, the poorest of the poor, engaging in illicit drug use? Because we have a number of them that are in various rehabilitation centers. Women, are you not and even young girls, are you not surprised? What can be the cause of this?
Well, I think it's alarming, but like I earlier mentioned, the women and their use of drug, it's been mostly men using in the past, but in recent times there's been a rise in drug use amongst women. And this is also worrisome because I have worked in quite a couple of rehabilitation centers here in Nigeria, and I've seen lots of young ladies and even mature women using drugs. This, for many of them, particularly the married ones, some of them are actually using drugs as a way of trying to escape from their realities of probably some marriage that isn't working. So the drug use helps them to kind of temporarily, help them avoid the emotions that are coming from the toxic relationships that are inside, And then there are other ones that are using because they've actually come from homes where drug use was also in use, and as a result, they have also told the same lie, And these drugs are quite harmful in terms of many of them have dropped out of school. So you find them in centers and they are just trying to see how we can help them recover and go back again to complete their school and maybe find some stable work they can do. So lots of issues, economic issues, and then the fact that the drugs are quite accessible is even the more worrisome fact.
Okay.
As you go around town, even in Abuja, you will find it. They are not hidden. It's not like in the past where drugs were not so common. They're on the streets. Virtually everyone, even though people who don't use, know where they are sold. So if you can see around,
thank you, doctor. I'll come back to you in the course of this program. Thank you for your comments so far. Involvement of women. What danger does this portend if the woman of the house, the stabilizing factor, as we call them in the home, is now into drug addiction?
You see, the society, we've placed so much importance and respect to the woman because she's a home builder. And when we get them, when we start seeing them get involved in...
we have a caller on the line. Just give me 1 minute. Good afternoon. Welcome to Kaftan TV. Your name and where you're calling from.
Good afternoon, Kaftan TV.
Good afternoon.
And all your guests. My name is Mohammed. I call from Medjugorje.
Okay. Please go ahead.
Yeah. I have listened to your program. In fact, I'm very interested. And the NDLEA former...
The deputy director, yes.
This societal, we especially in Medjugorje, we have witnessed effect of this useless drug caused by these Boko Haram boys, especially Ambassador Shekau. People who never knew who Shakau was one of the solution we will smokers before he joined former Mohammed Yusuf, and Yusuf converted him to become his recruitment officer of bringing all these useless drug boys from all the nook and cranny of the town into form this Boko Haram, and then the politicians used them for their political activity and dump them. The next thing, international collaborators came in and caught them and start sponsoring them up to the extent that they become a warlord, causing mayhem. In fact, Boko Haram is never a spiritual or religious organization. People never knew when they say Islamic, it is lie. There's nothing like Islamic. Somebody who doesn't even pray, who always on drugs, you can't call it Islamic. There are no Muslims. There can only be any name. Anybody can be any name. As we are now, I can be Mohammed. Tomorrow I can be Suku or Ajay. It is possible. This is what has happened and brought about this nonsense to Maiduguri and almost all parts of this country. So, the effect of drugs is one of the things that we have witnessed here, and we are saying no to it in all aspects.
What do we do? What do we do as a nation to rectify the wrong?
Yeah, yes, that is what I'm trying to advocate, that we should collectively reject it because it has a lot of consequences. It is too much consequences. On these kidnappers, whatever you think about, IBOB, whatever you think about, they use these drugs to motivate or trigger their people to cause this mayhem. People somebody cannot just sit down and say nobody should go to a market on Monday, sit at home. That kind of nonsense cannot happen with normal senses. So we must say no to it collectively.
Okay.
This is one of the contributions I'm making.
Thank you.
Well.
Thank you very much. We appreciate you.
Yeah.
He just gave us a nexus between drug addiction, drug use, and crime.
Yes, it's there.
It's a very serious problem. Almost all those that you see committing atrocities like kidnapping, terrorism are in drugs. How does the drug find its way into their hands? Why is it that I just told you of my area? You know, if you go to any corner, you said even under the bridge they are there. Why are they able to distribute effectively and enforcement is not able to catch up with them?
I'm sure you know that drug trade generates the highest amount of revenue,
huge resources,
the highest in the world put together than any other crime. So the point I'm trying to make here is it's a very, very lucrative business. And so people will go to any
length
to do it. Tell me, why will somebody inject drugs that you know if it busts, that's the end of your life? Why would somebody put drugs in anus? Why would somebody in his right senses knows that in Saudi is death sentence, in Southeast Asia country is death sentence, still wants to try? Now for the people doing crime, banditry, I can tell you outright that drug is fueling it. Drug is fueling it. I served in one of the northern states, and we were able to determine that the bandits in that state, they are on pentazocine. Pentazocine is a controlled drug. How do they get it? Some from hospitals, some from the pharmacy, because they have the right to stock them. And because if you have pentazocine, it's a pain relieving injection. Yeah. And so how many people will buy from you? So some of them have decided now to say, look, let me take the risk, stock it, and give it to the bandits and get more money. Take the risk. How many people did we arrest in that state that were involved in such trade?
Dr. Augustine, I want you to make your final comment on this program before I allow you to go.
Okay. to come to when we talk about drugs, you just asked a question, but I needed to just make. You ask how are they able to distribute this drug without anyone noticing?
Yes.
Recently, I was following up a case with one of my clients, and I asked, "How did you get this substance?" Because I actually wanted to know, and he said they will package them in this medicine bag, as if because before you go to where she's staying, you have to know the risks you will pass through to get that drug inside. Say she just say, I want to get malaria medicine. They will put this person, she has never interfaced with the seller. They communicate on, what's it called? Snapchat, where they don't even keep chats. Once they deliver, the chat disappears. Anytime she wants, she goes back to that name, chat the person, and that's it. And they package this in form of malaria medicine. When they bring it, nobody will say, oh, open your drug. Even if you see it, you see it's normal malaria, typhoid medicine package you are seeing. They put all these things there. Sometimes they even wrap them and fill them. When you see it, you don't even know that this is how they try to move it. They have different ways. I was talking to a friend recently. I said, I think I will have a conversation. Luckily, I met him. Say they should start. Some of these people that bakes, they should start checking them, monitor them, because they bake all these things inside cakes. They lace them. When he was talking about lacing, I was just smiling because I've seen people eating lace cake. That's why when I go to party, I don't eat cake. But when it comes to issue of women, because that was a question you asked me before,
yes,
it affects a lot of things about women. Because one, if you are a mother, because a woman is supposed to be a home builder, and when you are on drug, you are mentally not stable. You are psychologically not okay to manage a home. How do you intend to manage your home? And then it affects their menstrual flows. It also affects their birth, their fertility issues. So these are wide issues that we need to talk about, and we need to carry this advocacy.
In 1 minute, as a counselor, what would you tell somebody that is already on drug now?
Seek help. Help is always available. Don't keep it to yourself. Because you are already doing drug does not mean it's a death sentence already for you. Don't condemn yourself. Seek help. And once you seek help, you'll find help.
So rehabilitation still works?
Yes, obviously.
Okay. I must thank you, Dr. Augustine, for coming on the program. I wish you the very best. Well, thank you very much for coming. Now, we'll take a short break. We'll be right back.
Thank you.
Okay, welcome back. The program, the Polity, continues. Now, our phone line is open. We expect our viewers out there to call in and participate. We're discussing the drug issue in Nigeria, which many people believe that is a ticking time bomb. Now, my guest, I have two left, and another one will soon join us. Let me go to Asaba and ask our man there, Dr. Tigger. Now, let's look at rehabilitation now. You know, we have enforcement, then we have rehabilitation. Which one do you think that Nigeria should emphasize more so that we all agree that the drugs are everywhere now, and almost everybody, all segment, all strata of society is engaged in it?
All right. Thank you very much. So I think both rehabilitation and trying to break the chain of the distribution of drugs is important. But we can focus on rehabilitation. We already have a crisis. We have lots of people who are already hooked on these drugs. And many of these people cannot afford treatment. They cannot afford rehabilitation. The cost of rehabilitation is enormous. And the people who are already hooked on this drug, those who can't stop the use of these drugs, are quite a lot of them out there, and they cannot afford treatment. If the government can step in, it will be fine, just to make it more accessible, to make treatment more accessible to the people who need them, because they are our people. They need to be fine. If they are okay, they'll be able to contribute meaningfully to the economy. There are people who are brilliant. There are people who are hardworking. There are people who are knowledgeable and skilled. There are people who have the talent and the skill required to contribute their own quota to this country, but then they have a drug problem. So rehabilitation is useful. And if the government can work with the private sector to ensure that we have accessible and affordable rehabilitation services for those who are on these drugs. We hear they get caught every once in a while, but then the penalty is mostly for those who
slap
are
on the wrist.
dealers.
Oh, we lost him. Dr. Tigre, are you still there? Okay. Wow, we lost connection with him. Okay. Now, he was speaking about rehabilitation. Is NDLEA doing rehabilitation, or rehabilitation is left to state agencies like the juvenile home and the rest of them?
Let me say this. The drug issue has two approaches. First approach is the supply reduction. Arrest, investigate, seek conviction when there is a good evidence. Then the demand reduction, to reduce the capacity to demand, because some people will say if there's no demand, there's no supply. And so the demand reduction is not just rehabilitation. The demand reduction encompasses one, sensitization, to sensitize people as to the danger. There's counseling.
Yes.
Then there's rehabilitation. You can be counseled without going to the rehabilitation home. But at the rehabilitation home, they counsel you and give you treatment. So this is the two perspectives to addressing the drug challenge that we have. So for me, NDLEA is what I'm doing in all aspects.
Okay.
It's what I'm doing. We do rehab, we do counseling, yes, and we do enlightenment. We are everywhere talking to people. The bottom line of the whole challenge, I've told you, is that roles have been assigned to states.
Yes.
They are failing.
They should do their own part.
Local government have been assigned roles. There's the document called the National Drug Control Master Plan. That document assigned roles. Yes.
Okay.
So let everybody perform his or her own role in that document. And once we have that multidisciplinary approach to addressing the drug problem, you will see it will just drop.
Okay.
But for now, everybody is waiting for Buba Mara, or everybody is waiting for NDLEA. No.
Okay.
We all have to
roles to play. Okay. Yes. Now let's look at the other time we were talking about drug tests, even in schools now and universities. We pray that wisdom will prevail and it will be allowed. Now, how about our politicians? Some people have equally advocated that when anybody is seeking elective office, it should also be tested for drugs. What will you say from your experiences on the field and from what you can see now?
The chairman of NDLEA, Brigadier General Buba Mara, has advocated for it. And when he did, there was a lot of backlash. Yes. He has not only even advocated for the politicians getting to do drug tests, he's even saying people that want to do marriage, the husband and wife, because there's danger if one of them is doing drugs. I rehabilitated a medical doctor who I'm told has passed on He was introduced into drug by his wife. So, we also remember the history of one popular musician who was alleged that she was introduced into drug by her husband. So if a husband is doing drug and the wife is not doing it, and the wife so much believe that this is my man and I want to keep the marriage, she might join the husband. It's happening. Yes. And there are men, one interesting thing about these things, our ladies, some of them have come up with this notion, I don't know where they got it from, that drugs will improve your sexual libido. And so they are doing it for that, which is dangerous. The other man was saying something about mothers. The challenge of mothers doing drugs is that
It's gone.
the womb. When you have a mother that is doing drugs, the drug flows in the blood. When she's pregnant, of course, the child in the womb will participate.
Okay.
And when the child is giving birth to, there's a danger.
Okay. Let's take another minute. Okay. The phone line is still open. Please call in to be part of the program. Now we have Dr. Tigre is back online. Well, good to have you back. Now, I want you to give us your closing comments because the network is not stable, whether with you or with us here. Now, if you are to advise on how we can, from your experience now, how we can get out of this quagmire, what will you advise?
Okay, thank you very much. So I'm sorry for the network. When it comes to drug use, I think we need to address it from where it starts from. So it starts from two ways. It starts from the womb, so it comes from where the children are growing up in the families where they are, and then they are exposed. Whatever form of drugs they are exposed to is usually their point of initiation into drug use. So we don't expect to have parents who are, let's say, smoking cannabis, and then they have children, and the children are not going to smoke cannabis. It's very unlikely. We'll learn from it. Consciously or unconsciously, they do. Many of the people around who smoke cigarette will tell you that their parents actually sent them to buy for them. So we must start from there. Can we start from that home? So we can start by preventing its use, and we can start with the young ones that are coming up. For the adult ones, we can talk about rehabilitation for them. But for the young ones that are coming up who are in primary school, in secondary school, what kind of awareness do we have on the dangers of drug use for this group of people? What kind of programs do we have that are shown on TV or are aired on radio that help to discourage drug use? That's where I think we can start from.
Okay.
Then, on the other hand, I think also strongly believe that the government can also do more in terms of trying to break that chain of drug spread, because currently the rate at which we are seeing drugs everywhere is
okay. I must thank you, Dr. Tigre, for coming on the program. We wish you the very best of luck. I didn't even ask you how is Asaba this afternoon.
Asaba is good. Asaba is very fine.
Okay. Thank you very much. We'll be in touch. Bye-bye. Now, the program continues. And in fact, I have a guest that is equally waiting on Zoom, where we'll be linked up with him in a short while. Even if it is 2-3 minutes, he will still share with us on the program. Now, let's begin to wind down now. From some of the experiences that you have gathered after retirement, in terms of advocacy, who are those listening to you? Is it the drug addicts? Have you been able to connect with the parents? Have you been able to reach government to do more to dissuade people from drugs?
Well, I just retired, and so I'm just putting my hands together to see how I will take it up from there. Of course, I've reached out to my primary constituency, the NDLEA, and we have a couple of things I've put forward that I think we can do together. I have also reached out to some government institutions for advocacy visits. Like I mentioned, I have been able to, I'm an executive producer of films, about 3 or 4 of them.
Oh, using the media.
Yeah, that has to do with the consequences of a drug. What I've done there is my experience on the job, what I encounter. I'm trying to play it back so that parents will be able to appreciate what they need to do in order to prevent it from happening. Because when it happens, you need the grace of God to be able to take it away. Yes, I must tell you.
Yes.
I must tell you that people who are substance abusers, it's not an easy task to get them out of it.
So rehabilitation is very difficult and costly.
Tough, not the cost it's not the cost, but tough to get somebody that is addicted out of it. Very difficult. That's why at times you find somebody who would have visited 1, 2, 3, 4, 5 rehab centers. You come out of it, you are okay. Along the line, your friends get you to get involved again. So it's a bit challenging there, but I do hope that as I move on, I'll be able to get the government and schools.
Thank you very much, sir. Like I said earlier, yes, we are being joined by another guest on the program, Mr. Kenneth. Please give us, introduce yourself and your agency. Okay, please go ahead. Okay. Yeah, we're having issues with this network. Maybe the engineers will still continue to try. It could still be possible to have a word or two from him. Now, you spoke about collaboration with the NDLEA. I'm sure there are other agencies that are working with the NDLEA in this area. What are the what you call achievements so far? Are the NGOs, are they able to reach these unreached people? Because when you see news reports of people, addicts, people that are on drugs, under the influence of drugs in some places, especially in Kano and some northern states, you feel very, very sorry. Are they being reached, and how?
Well, like I said, I'm just starting. They are being reached. But most importantly, I also want to say again, like I've emphasized, let me re-emphasize, that the partnership between NDLEA, the state, and the local government is key in the sensitization. It's key in the sensitization. You find those who are doing this substance, they will tell you, until I got in, I didn't know it was so bad. Help me. Yes. So for me, we need to do more campaigns, more enlightenment to create the awareness of the danger. That when you are in, these are the consequences. And getting out is the grace of God, from my experience.
Okay. Now, I am just being told that Mr. Kenneth is ready. Good afternoon. Please introduce yourself and your agency.
Okay, my name is Kenneth Aneto. I'm the current executive director of the Newton International Foundation. I also am the consultant for the Senate Committee on Drugs and Narcotics. I'm also a member of the Presidential Special Committee for Elimination of Social Vices in Secondary and Tertiary Institutions.
Okay. Now, you have a very robust credentials there. Now, tell us part of your work, part of the work that you have done with the National Assembly in terms of legislation and implementation of those legislations, and that's going into your work with the other areas, other NGOs that you work with.
Okay. Thank you very much for this opportunity again. In terms of work with National Assembly, at least in advisory capacity, I've been working with legislators to make them include substance abuse prevention and enlightenment initiatives as part of their constituency project, advising them on evidence-based programs to carry out, and working with them to see that the programs that they carry out are not just flash for show, but programs that have long-term impact in the community. Also, in terms of in the season when the NDLEA Act were being amended, civil society organizations reached out to have their input in the concerning the death sentence, of which the NDLEA never intended to have a death sentence. That it was something that came up in the chambers, and some of these things were mediated out because the NDLEA has a public health approach towards is working on an approach that is more humane. They never intended to have death sentence. So when the NDLEA Act included a death sentence through mediation, that was also taken out. Apart from that, we've had other things that we do with civil society organizations, rallying together, bringing together. I work as the National Vice Chairman for the Association of Advocates Against Alcohol Harm in Nigeria. In that capacity, we are currently working on a national alcohol policy in collaboration with the Federal Ministry of Health that has brought all stakeholders together for the past 2 years to see how we can chart a way forward in terms of having evidence-based alcohol policy in Nigeria.
Okay.
And in capacity of the Newton International Foundation, for the past 10 years, I've been having sensitization programs.
NGOs in this country asking for stricter laws. You know, you mentioned the issue of a death sentence now. Are we likely to see that, like we have in Indonesia, like we have in China, and some other nations?
Evidence has shown over time that death sentence does not really help to curb substance use, because most countries, the Pakistan, those countries that they put up that death sentence, they ended up not reducing the amount of people that are being arrested, because most people that peddle these drugs are always people on the lowest level of the cartel. That's why sometimes they use women, they use other disadvantaged groups as mules to move these drugs, of which those people are expendable. So having death sentence for a particular person being caught with a particular amount of substances has never been the plan of the NDLEA, and it's not an evidence-based approach or policy to reducing substance use.
Okay, so we are unlikely to have that, especially coming from the NGOs. Okay, now let's look at quickly now the issue of participation of youth. You yourself, you are a youth. Now, when you interact with the youth population, what do you tell them, and how receptive have they been when you tell them of the need to stay off drugs?
By the grace of God, I've been opportune to talk to youth in different parts of this country. And most recently, I'm more opportune to be in the north, in the Maiduguri, in the Sokoto, in the Bauchi, the Kebbi, and all those regions. And as someone that has been trained by the United Nations Office on Drugs and Crime, we don't use scare tactics to inform people. Instead, we use evidence-based programs. One of those evidence-based programs that was developed with the United Nations Office on Drugs and Crime, the UNODC, and input from other civil society organizations is called Unplugged, and the other one is Drug Education. I'm a trainer on drug education, and drug education is a curricula. It's in 2 parts that can be used on different age groups to inform them on the dangers of substance abuse without putting fear tactics forward. You give them facts so that they can make informed decisions, because everybody is intelligent. You can't force anybody to do anything, but if the person has the right information, he's more likely to make better choices.
So
and
they are
that's
listening
what
to
some
you.
of these programs
You are reaching them.
They listen. Yes, they listen. They
Okay.
listen. They listen, and we are seeing improvements.
Your final word on the program. You think we can win this war against drugs? Do you think so?
If we keep looking at it as a war, the other part will continue to fight back. But if you look at it as a public health challenge, not a moral issue, not a battle, then you can begin to treat what is going on.
Okay.
I believe that Nigeria has hope.
Okay. Thank you very much for coming on the program, Mr. Kenneth. We hope next time we'll be able to have more time with you because I know you are loaded with a lot of information. Thank you very much for coming on the program. Now, Mr. Mahmoud, your final word on the program. My other guest just told me that it is not a war, but a public health challenge. Whether war or public health challenge, is this surmountable?
Sure.
Yeah.
We can.
Okay.
We can address it.
Okay.
All we just need is for everybody to play his role.
Okay.
From the home, local government, the state, the clerics, both the Christians and the Muslims, everybody has a role to play. Yes, and those roles have been clearly
specified.
There's a presentation that is titled something to do with the role of everybody in the fight against drug abuse.
Thank you.
And so if everybody plays that role,
yes,
I will encourage your station. Let's discuss that role in one of your programs.
Okay.
The role of everybody. If everybody plays his role, this thing will be something of the past.
Thank you very much. That's Mr. Mamadou Sule. He's a retired deputy commandant of the NDLEA. I must thank you for coming on the program.
Thank you very much.
I call him the last man standing. Thank you, sir. Well, this is where we call it a date on the program, the Polity. Do join us tomorrow for another edition. But join me at 8 p.m. for Matters Arising. Good afternoon.